Male infertility. If you or someone you love is trying to conceive but struggling, you're not alone. Millions of men across the world face infertility. But what causes it? And how can you spot the symptoms early? Let's break it down. What is male infertility? Male infertility refers to a man's inability to cause pregnancy in a fertile female partner after 12 months of regular, unprotected intercourse. While many people think of infertility as a women's issue, in about 40 to 50% of cases, male factors play a role. How does male fertility work? Let's understand the basics of how male fertility works. For a man to be fertile, 1. His body must produce healthy sperm. 2. The sperm must be carried in semen through the reproductive tract. 3. There must be enough sperm in the semen. 4. The sperm must be able to swim and reach the egg. If any part of this process is disrupted, fertility can be affected. Symptoms of male infertility. So what are the symptoms of male infertility? Unlike women, men often don't have obvious signs, which is why many cases go undiagnosed until couples start trying to conceive. But here are some things to watch out for. Common symptoms include inability to conceive after a year of regular, unprotected sex, low sex drive or reduced libido, erectile dysfunction, trouble getting or keeping an erection, pain, swelling, or lumps in the testicular area, decreased facial or body hair, a sign of hormonal imbalance, small or firm testicles, reduced volume or abnormal appearance of semen, gynecomastia, enlarged breasts in men. These symptoms don't always mean infertility, but if they persist, it's important to talk to a doctor. Major causes of male infertility. Now let's talk about what causes infertility in men. There are many possible reasons, and they can be grouped into 4 main categories: medical, environmental, lifestyle, and structural. 1. Medical causes. These are health-related conditions that directly affect sperm production or hormone levels. Varicocele, enlarged veins in the scrotum that overheat the testicles and reduce sperm quality. Infections, STIs like chlamydia or gonorrhea, mumps, or prostate infections. Hormonal imbalances, low testosterone, hypogonadism, pituitary gland disorders, thyroid dysfunction. Genetic disorders, Klinefelter syndrome, Y chromosome microdeletions, cystic fibrosis. Retrograde ejaculation, semen enters the bladder instead of exiting the penis during orgasm. Undescended testicles, testes that failed to move into the scrotum during childhood. Tumors or cancer treatments, chemotherapy, radiation, or surgery can impair fertility. 2. Environmental causes. Some jobs or exposures can negatively affect sperm production. Heavy metal exposure, lead, mercury. Radiation or X-rays. Overheating the testicles from frequent use of saunas or laptops placed on the lap. Exposure to pesticides, industrial chemicals, or solvents. 3. Lifestyle factors. Our daily habits can have a major impact on fertility. Smoking lowers sperm count and motility. Alcohol and drug use decrease testosterone and sperm quality. Obesity alters hormone levels and increases scrotal temperature. Chronic stress affects hormone production and sexual function. Poor diet deficiencies in zinc, vitamin C, and folate can impair sperm health. 4. Structural problems. Sometimes, physical blockages or damage to the reproductive tract can cause infertility. Blockage in vas deferens, the tube that carries sperm. Injury or surgery to the testicles, groin, or spinal cord. Ejaculatory duct obstruction. Some men are born with these issues, others may develop them later in life. How is male infertility diagnosed? Narrator. If you've been trying to conceive without success, it's time to visit a doctor. Diagnosis usually starts with a semen analysis, a simple lab test to evaluate sperm count, shape, and movement. Other tests may include hormone testing, like testosterone, FSH, LH. Scrotal ultrasound. Genetic testing. Urinalysis to check for retrograde ejaculation. Testicular biopsy in rare cases. Early diagnosis can make a big difference in treatment outcomes. Is male infertility treatable? Yes, the good news is many cases of male infertility are treatable. Treatment options include lifestyle changes, quitting smoking, weight loss, stress reduction. Medications, hormone therapy or antibiotics for infections. Surgery, to fix varicocele, repair blockages, or correct undescended testicles. Assisted reproductive techniques, ART. IUI, intrauterine insemination. IVF, in vitro fertilization. ICSI, intracytoplasmic sperm injection, where a single sperm is injected into an egg. Final thoughts and takeaway. Infertility can be emotionally difficult, but it's important to remember, you're not alone. Key takeaways. Infertility affects men as often as women. It may have no obvious symptoms, but issues like low sex drive, testicular pain, or hormonal changes may be clues. A healthy lifestyle goes a long way in improving fertility. Early testing and medical support can make a big difference. If you've been trying for over a year without success, don't hesitate to talk to a fertility specialist. The sooner you take action, the more options you'll have. Outro. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit. Don't forget to subscribe for more health and wellness content and hit that notification bell so you never miss an update. Stay informed, stay healthy.